The Lambda variant, vaccine-resistant and more contagious? The Lambda variant has attracted attention as a potential new threat in the development of the COVID-19 pandemic. The Lambda variant of the coronavirus, first identified in Peru in December, may be receding, but also has the chance of causing more severe disease if not stopped. Cases had been found in Texas and South Carolina, and in 81% of the cases found in Peru. The Lambda variant has mutations that resist vaccine. Two mutations in the Lambda variant, T76I and L452Q, make it more infectious than the COVID variant that swept through the world in 2020. The conclusions of the study matched findings by a team in Chile that found the variant might also evade vaccine antibodies, Chile Infection Control reported. This report has not yet been reviewed by peers. A COVID-19 variant that proves to be resistant to vaccines keeps medical experts, public health officials, and health care professionals on the front lines of the COVID-19 pandemic up at night. What is the Lambda variant according to a study from Chile? Background: the newly described SARS-CoV-2 lineage C.37 was recently classified as a variant of interest by the WHO, Lambda variant, based on its high circulation rates in South American countries and the presence of critical mutations in the spike protein. The impact of such mutations in infectivity and immune escape from neutralizing antibodies is entirely unknown. Methods: we performed a pseudotyped virus neutralization assay and determined the impact of the Lambda variant on infectivity and immune escape using plasma samples from healthcare workers HCW from two centers in Santiago, Chile who received the two-doses scheme of the inactivated virus vaccine CoronaVac. Results: we observed increased infectivity mediated by the Lambda spike protein that was even higher than that of the D614G, lineage B, or the Alpha and Gamma variants. Compared to the wild-type, lineage A, neutralization was decreased by 3.05-fold for the Lambda variant while it was 2.33-fold for the Gamma variant and 2.03-fold for the Alpha variant. Conclusions: our results indicate that mutations present in the spike protein of the Lambda variant of interest confer increased infectivity and immune escape from neutralizing antibodies elicited by CoronaVac. These data reinforce the idea that massive vaccination campaigns in countries with high SARS-CoV-2 circulation must be accompanied by strict genomic surveillance allowing the identification of new isolates carrying spike mutations, and immunology studies aim to determine the impact of these mutations in immune escape and vaccines breakthrough. The emergence of SARS-CoV-2 variants of concern and variants of interest has been a hallmark of the COVID-19 pandemic during 2021. The newly assigned SARS-CoV-2 lineage C.37 was recently classified as a variant of interest by the WHO on June 14 and denominated as the Lambda variant. The presence of this new variant has been reported in more than 20 countries as per June 2021, with most of the available sequences coming from South American countries, particularly from Chile, Peru, Ecuador and Argentina. 5. This new variant of interest is characterized by the presence of a convergent deletion in the ORF1A gene, delta 36753677, already described in the beta and gamma variants of concern, and mutations delta 246 to 252, G75V, T76I, L452Q, F490S, T859N in the spike protein 6. The impact of these spike mutations on infectivity and escape to neutralizing antibodies are completely unknown. Chile is currently undergoing a massive vaccination program. According to public data from the Chilean Ministry of Health as per June 27, 2021, 65.6% of the target population, 18 years old and older, have received a complete vaccination scheme 7. The vast majority, 78.2%, of the fully vaccinated population have received the two-doses scheme of the inactivated virus vaccine CoronaVac, which has been previously reported to elicit neutralizing antibodies but at lower titers when compared to plasma or sera from convalescent individuals. Here, we used our previously described pseudotyped virus neutralization assay 12 to determine the impact of the Lambda variant on the neutralizing antibodies responses elicited by the inactivated virus vaccine CoronaVac. Our data show that mutations present in the spike protein of the Lambda variant confer increased infectivity and escape to neutralizing antibodies elicited by the inactivated virus vaccine CoronaVac. Methods. Health care workers from two sites in Santiago, Chile were invited to participate. Volunteers received the 2 doses scheme of CoronaVac, each dose being administered 28 days apart according to the Chilean vaccination program. Plasma samples were collected between May and June 2021. All participants signed informed consent before any study procedure was undertaken. Public data analysis. Ethical approval. The study protocol was approved by the Ethics Committee of the Faculty of Medicine at Universidad de Chile, Projects N-degree 0361-2021 and N-degree 096-2020, and Clínica Santa Maria, Project N-degree 132604-21. All donors signed the informed consent, and their samples were anonymized. Impact of the spike mutations in the Lambda variant on infectivity and neutralizing antibodies responses. An analysis of 3,695 sequences from Chile deposited at GISAID as per June 24, 2021 shows a clear dominance of the SARS-CoV-2 variants Gamma and Lambda during the last trimester accounting, together, for the 79% of all sequences. Interestingly, this period has been characterized by a massive vaccination campaign in which 65.6% of the target population 18 years old and older individuals have received a complete vaccination scheme as per June 27, 2021. Given that 78.2% of the people inoculated with a complete scheme received the inactivated virus vaccine CoronaVac from Sinovac Biotech, we sought to investigate the impact of the spike mutations present in the Lambda variant on the neutralizing capacity of antibodies elicited by this vaccine. For this, we generated HIV-1-based SARS-CoV-2 pseudotyped viruses carrying the spike protein from the Wuhan 1 reference lineage, wild type, lineage A, the D614G mutation, lineage B, and the alpha, lineage B1.1.7, gamma, lineage P1, and lambda, lineage C.37, variants. During virus preparation, we consistently observed that cells infected with the pseudotyped virus carrying the lambda spike produced significant higher bioluminescence values when compared to the D614G mutant or the alpha and gamma variants, indicating increased infectivity driven by the lambda spike protein. Discussion. High SARS-CoV-2 transmission is occurring in Chile despite an intensive vaccination campaign, which mostly relies on in the inactivated virus vaccine from Sinovac Biotech and to a lesser extent in the mRNA vaccine from Pfizer-BioNTech and the non-replicative viral vector vaccines from Oxford, AstraZeneca and CanSino Biologicals. The last surge reported in the country has been dominated by the SARS-CoV-2 variants Gamma and Lambda, the former classified as a variant of concern several months ago and the latter being recently recognized as a variant of interest by the WHO. While the Gamma variant possesses 11 mutations in the spike protein including those in the receptor binding domain RBD, associated with increased ACE2 binding and infectivity N501Y, or immune escape K417T and E484K, the spike protein of the Lambda variant has a unique pattern of 7 mutations, delta 246 to 252, G75V, T76I, L452Q, F490S, D614G, T859N, from which L452Q is similar to the L452R mutation reported in the Delta and Epsilon variants. The L452R mutation has been shown to confer immune escape to monoclonal antibodies (mAbs) as well as convalescent plasma. Moreover, the L452R mutation has also been shown to increase viral infectivity, and our data suggest that the L452Q mutation present in the Lambda variant might confer similar properties to those described for L452R. Interestingly, the 246 to 252 deletion in the N-terminal domain (NTD) of the Lambda spike is located in an antigenic supersite and therefore, this deletion might also contribute to immune escape. Moreover, the F490S mutation has also been associated with an escape to convalescent sera. Consistent with these antecedents, our results indicate that the spike protein of the Lambda variant confers immune escape to neutralizing antibodies elicited by the CoronaVac vaccine. Whether the Lambda variant also escapes to the cellular response shown to be elicited by CoronaVac is still unknown. We also observed that the spike protein of the Lambda variant presented increased infectivity when compared with the spike protein of the Alpha and Gamma variants, both of them with reported increased infectivity and transmissibility. Together, our data show for the first time that mutations present in the spike protein of the Lambda variant confer escape to neutralizing antibodies and increased infectivity. The evidence presented here reinforces the idea that massive vaccination campaigns in countries with high SARS-CoV-2 circulation rates must be accompanied by strict genomic surveillance aimed to rapidly identify new viral isolates carrying spike mutations, as well as studies aimed to analyze the impact of these mutations in immune escape and vaccines breakthrough. COVID-19 is fast progressing. This can be seen in Hawaii, where numbers were low and jumped to a record high with tourism booming.